my lumbar spine reads that there is degeneration of 4 lower discs. So at L2, L3, so that's in between those two vertebrae, the disc, there's a mild bulging of annulus without central nerve impingement. In L3, L4, there's bulging of the annulus effacing the anterior epidural fat, and there's a broad-based left protrusion that likely impinges on the left L3 nerve root. At L4, L5, there's a broad-based bulging of the disc effacing the anterior epidural fat, and there is a small central annular tear as well. There's another protrusion, likely impinging the L4 nerve root. At L5, S1, there's a moderate-sized broad-based central protrusion. My hip, early degenerative cleft in the pubic symphysis cartilage. There's a possible small labral tear. In the right hip, degenerative change within the left labrum, possible tearing. Lateral aspect of the left labrum appears blunted. Maybe a little new bone formation at the femoral heads and the femoral necks. A significant oedema seen within the posterior aspect of the left iliac bone at the level of the SI joint. There's evidence of fatty scarring on the iliac side of the right SI joint. We'll cover the shoulder quickly. It still shows there's mild degenerate change in the SE joint, and there's probable early impingement of the supraspinatus. But yeah, the neck. There is a degeneration of the upper 4 cervical discs. There's a loss of cervical lordosis. There's evidence of early posterior osteophytes at C3, C4, C4, C5, and C5, C6. So extra bony growth. C5, C6, there is bulging of the annulus with small left posterior lateral protrusion, which effaces the anterior epidural fat. There is stenosis, so that's closing of the bone, like extra bone, of the left foramen by osteophytes, and there is nerve impingement of the C6 nerve root. There's a small syrinx in the cervical cord at C6, C7 that measures 3 centimeters,